All right, I see people coming into the webinar now. We'll just give folks another minute before we get started. All right. Thank you so much for joining, everyone. My name is Nadine Brown, and I'm the Director of Marketing and Communications here at Serefin Health. I'll be your moderator today. Welcome to our webinar on Amplifying Health, Care Coordination, Care Concierge for those who need it most. Thank you so much for joining and for opening up this conversation. We're looking for or helping you to look for new ways to support individuals and caregivers to navigate care. Shortly, I'll be introducing our special guest, Vanessa Durante. All right. So I'd like to take a moment to acknowledge the land on which we live, work, and gather. Serefin's head office is in Toronto, which sits on the traditional territories of the Wendat, Haudenosaunee, and Anishinaabe nations and Mississaugas of the Credit First Nations. Toronto is also home to many diverse nations, including Inuit, Métis peoples. We honor their history, culture, and contributions. In the next 15 minutes, we'll share what care coordination looks like in practice, sorry, and how Serefin Health's Care Concierge works. We'll then dive into the preview program and how your organization can partner with us to connect with people in unique ways. And this is a complimentary service where we hope will find a tremendous opportunity. First, let's take a few housekeeping items off the board. We ask that everyone stay muted until the end of the webinar. Please raise your hand, your virtual hand, if you have a question you feel the group will benefit from. I encourage all to stay for the duration of the webinar, but we will be sending a recording of the webinar to all attendees. All right, let's level set. We'd like to get a sense of where everyone's starting from. We're going to launch a quick poll to help us understand your current familiarity with care coordination. Take a moment to make your selection. We'll give everyone about 30 seconds. All right. So what is your general level of knowledge with care coordination? Is this the first time you've heard of it? Or you've heard of it in passing before? Or you have a basic understanding? You may have a solid or thorough understanding. Or you have firsthand experience. All right, everyone, please submit your answers. All right. Oh, excellent. Great responses. So it looks like about 30% of our attendees here have a solid and thorough understanding, which is great. That'll open the door for Vanessa. Excellent. Thank you. Now I'm pleased to introduce our guest speaker for today, Vanessa Durante. Vanessa?
Thank you so much, Nadine, and thank you to everyone joining us today. My name is Vanessa. Like Nadine said, I'm the Vice President at Serefin Health and a registered nurse. I would like to start by grounding us in three key themes that shape the heart of our work here at Serefin Health. These ideas are not just concepts, they really reflect the human side of healthcare navigation and what makes our approach unique. First is care coordination. This is about the deliberate organization of care, making sure that all moving parts work together across different providers and services. It's how we ensure care is not only safe and appropriate, but is also truly effective. When coordination is done right, individuals don't have to figure out things out on their own. We are there with them to guide them. Second is Care Concierge. This is our unique care coordination service, personalized, proactive, and easy to access. Whether someone is facing a new diagnosis or simply needs help navigating next steps, our Care Concierge offers one-on-one support. It's about removing the guesswork and making complex care feel manageable. And finally, connection. At Serefin, we truly believe care starts with the human connection. Technology plays a key role, but it should enhance, not replace, the relationships at the center of care. We emphasize compassion, trust, and real conversations because to us, that's what turns support into something truly meaningful. These three pillars, care coordination, care concierge, and connection, will continue to be threaded through this entire session. They are what guides our work, and more importantly, they really reflect the kind of care we all want for ourselves and for our loved ones. So before we go any further, I do want to take a moment to tell you a little bit about Serefin Health. We are a Canadian organization grounded in a simple yet very powerful mission. We make healthcare easier to understand and navigate for everyone. Through our proprietary app, our care coordinators provide personalized, real-time guidance, helping individuals and families manage everything from chronic conditions to mental health concerns. Whether it's finding the right support, booking an appointment, or simply making sense of their care plan, we are there every step of the way. Through our Care Concierge service, we are proud to say we have supported over 80,000 individuals. This number reflects more than just people. It really reflects lives made easier, stress reduced, and connections made stronger. At the heart of what we do is a deep belief in compassionate, human-centered care, powered by smart technology, but always grounded in trust and in relationship. We have all felt it or at least watched someone struggle with this. Navigating the healthcare system today can feel quite overwhelming, especially for individuals managing multiple chronic conditions, maybe trying to age at home or juggling care for a loved one. There's no simple roadmap, and every appointment, referral, follow up can become a burden to coordinate. I believe this slide says it all. Individuals are often left on their own to piece everything together, from specialists to diagnostics to mental health, virtual care, pharmacy. The truth is, our healthcare system is not designed with the individual at the center. It's exactly why we believe care coordination matters now more than ever. At Serafin, we believe no one should manage this complexity alone. Care coordination steps in to connect the dots, remove barriers, and ensure people get the right care at the right time with the right support. Okay, so Care Concierge is our virtual support service that connects people with real, compassionate care coordinators who walk alongside them, no matter where they are in their healthcare journey. We know that navigating care isn't just about booking appointments, it's about understanding what happens after diagnoses, figuring out which services are right for them, and knowing even where to begin. That's where our experienced team steps in. Using the Serefin Health app, we help individuals, families, their caregivers make sense of it all. Bridging the communication between providers, supporting the decision making that has to happen, and offering a personalized follow through. Importantly, Care Concierge, it is not about replacing anyone's provider. It is here to complete the circle of care. We are the connectors between people and the system they need, ensuring that the care is not only coordinated, but truly continuous and more than anything, compassionate. So this is what we believe care can look like when it's done right. It's truly coordinated and centered on the individual. Instead of being left to navigate a mess of disconnected services, wonder who to call next, or sit with a new diagnosis, not knowing the real plan, the person is surrounded by a supportive, connected network. With Care Concierge, we're no longer alone in making sense of the system. They have someone on their corner, someone who can help them access the right care at the right time from the right individuals. This isn't about getting services, it's about getting support, being connected, and getting clarity in a health system that too often feels confusing and a little bit overwhelming. That's the future we're really working towards, where care coordination hopefully is not just a luxury for some, but a standard for all. Okay, so now that we have heard a bit about what Care Concierge is and how it works, I want to now introduce you to our preview program, a unique opportunity to experience this support firsthand. This initiative was designed to introduce individuals and caregivers to our service, while also helping us learn how to better shape and scale care coordination across the country. It's completely complimentary for an unlimited amount of participants in 6 different care areas, which I will speak to at the next slide. But to put into perspective, in a typical setting, this level of personalized support could cost around 4,000 per person per year. So you can really see where the value can be here for these individuals that are participating. Participants access the service through our healthcare app, and they can continue receiving support for as long as they need it. As I mentioned, the Care Concierge program is open to individuals and caregivers who we believe benefit from extra support in navigating their care journeys. We are focusing right now on 6 key groups, each facing unique challenges where coordinated care can really make a real difference, like older adults managing chronic conditions, individuals navigating cancer care at any stage, those living with dementia or Alzheimer's and their caregivers, new and expecting parents, neurodivergent adults, and lastly, individuals and their families receiving palliative care. These represent um, the groups where we believe Care Concierge can make an immediate and lasting impact. Okay, so to get started with the Care Concierge Preview Program is really simple. We have designed it to be seamless as possible. First, they have to sign online at serefin.com/preview program. Once they've registered, they'll receive a unique code to use within the Serefin Healthcare app, which can be downloaded in the Apple Store and Google Play. Next, they will use the app to schedule an intake session at the time that works for them. From there, they will be matched with a dedicated care coordinator based on their unique needs and care category. After they complete the short virtual intake session, they will get personalized care concierge at no cost or in the future. I think Nadine, you're muted.
Oops, thank you. Thanks for that, Vanessa. So as we mentioned, there are 6 categories that the preview program is dedicated to at this time. All of the participants would have access to the app, but we'd like to tell you a little bit more about the program, and we've put together a video that tells you a bit about kind of the experience for the end-to-end user. So if we can run that video, that'd be great.
Navigating the complexities of healthcare can be daunting, but with Serefin Health's Care Concierge, you will feel confident and cared for at every turn. Discover personalized healthcare support with Serefin Health's Care Concierge. Our dedicated team offers one-on-one assistance tailored to your unique needs, utilizing secure technology to connect individuals and caregivers with relevant resources and care solutions. Experience peace of mind knowing you have a trusted partner by your side on your health journey. Serefin Health's Care Concierge experts provide personalized guidance crafted to suit your requirements, whether it is finding specialists, understanding medication, or coordinating services. With our secure technology, we prioritize your privacy and efficiency, giving you seamless access to expert support. Our advanced technology streamlines care coordination, providing real-time support and secure access to resources whenever you need them. Wherever you are in your health journey, Serefin Health's Care Concierge is here to support you every step of the way.
Great. Thank you. What a wonderful visual of ways Care Concierge can support individuals and caregivers. We want to highlight here again that this could be life-changing for someone in your community at no cost at all. Whether you work in outreach, service delivery, or just want to help, we've made it easy to spread the word. Just email care.concierge@serefin.com and we'll send you digital and printed materials to use to promote the preview program. There's no commitment on any part of any organizations we invite to participate. Just support us in reaching the people who could benefit from this service the most. All right, so we'd like to open up now to our Q&A session. We're right at the point in the webinar where we'd like to do that 15-minute mark. Do we have anything in yet? So let me just check. All right, so this is the Q&A portion. You'll put your questions right in the Q&A link at the top, right at that button. And it looks like we do have some in now. Okay, first one. How would a care coordinator prep someone for a specialist appointment? I think that one's for Vanessa.
That's a great question. One of the key ways our care coordinators add value is by helping individuals prepare for important health visits, like a specialist appointment, for instance. This includes reviewing why the appointment was booked, helping them gather relevant records, test results, and even generating a list of questions that they can ask. We make sure that they understand what to expect and feel confident walking into that appointment because we believe people when they feel prepared, they're better able to advocate for themselves and have more effective outcomes in making the right decisions for themselves.
Oh, excellent. Excellent. And it's so wonderfully personalized. So that's good. The next question is, does the participant have to start paying after some sort of trial period? So that sounds like a marketing and communications question. So I'll take that one. There's actually no trial period. We've opened up the preview program to those who need it most, and there's no payment because there's no trial period. There's really no payment to be made. We just would love for people to remain active in the program. That means that as long as they need it, the service will be there for them. If we find that there is some inactivity for a duration of time, we'd love to open up that seat, that opportunity for someone else. So as long as participants are active, they are welcome to use the program at no charge. All right. Looks like there is a question about how does Serefin protect patients' privacy? It's a great question. That one, I believe there are definitely privacy parameters in place. We operate just as any kind of healthcare organization where we take privacy very seriously. All of the data we collect is anonymized. Only the care coordinator and the participant will be sharing their files and reports. And so the data is extremely secure in accordance with all of the healthcare parameters that are associated with healthcare in Ontario and Canada. Anything to add to that, Vanessa?
No, I think you said it beautifully. We definitely cover all our bases from a safety security perspective, from a having the information secured. Yeah.
Okay, great. If you'd like more information on that, please feel free to email us and we can give you more information. Another question that's come in is, if I have a parent with dementia, can I somehow also be connected to their account and perhaps sit in on appointments with them with the Care Concierge?
I could probably
Vanessa?
take that one. Yeah. So yes, absolutely. We understand that care often involves more than just individuals. It usually includes families, caregivers as well. So with the participants' consent, caregivers can be looped into their account, receive updates, join virtual sessions, and be involved in planning or the follow-ups. In the case for dementia and Alzheimer's, like you mentioned, having a caregiver involved is often essential and needed, and our platform supports that kind of collaboration from the start.
Great. All right. And I have another question here. This is great. Lots of wonderful questions. Will you provide me with materials to help promote this within my organization and to my patient population? So this is from an organization, it looks like. Yes, we will provide your organization, all of our partners, with the materials they need to promote the program, from emails to posters, videos, all of the digital assets as well. We will even provide, as we move along in the program, provide testimonials as we receive them. And all of this will be made available. We'd like to make it, package it up and make it as easy for you as possible to promote. All right. I'm going to take a quick look here. Excellent. It looks like that rounds out our questions. All right, last call for Q&A. Oh, actually, I do see two more. First one is my org offers support and educational workshops that would be relevant to your patients. How could you promote these to the care coordinators? That's great. So I love that kind of bilateral communication. So if the organization has services that our care coordinators could benefit from to share with our preview program participants, absolutely. So we would definitely do that. Thank you, Leslie, for that question. And as Vanessa mentioned in some of the earlier slides, we do provide resources. That's a part of the care coordinator function, is we provide those resources that the participant might not be aware of. So we'd love to share that with the organizations we're working with. All right. And the next one is, how do care coordinators manage specialist treatment appointments across provinces and territories? So the program is Canadian, but so that's good that we're only talking about provinces and territories, but I'll let Vanessa take that question.
Yeah, no, again, that's another great question. And again, what I mentioned earlier, I'll kind of reiterate. So our care coordinators help the individuals keep track of all the appointments, what's kind of going on, the next steps in the therapies they support. So we do have on the care coordinator side, we do have a software that helps them keep everything in line so it doesn't get lost or forgotten. And the care coordinator then supports that individual with keeping track of all the appointments, the treatments they're doing, whether it's virtual or in person. They'll help them manage that piece. And everybody will be unique to the level of support they'll need. So the care coordinator will work with them to make sure they get the level of support that's needed for their care coordination to be effective.
Great. That's great. So no real barriers across kind of our imaginary borders through provinces. We can definitely manage or coordinate if they have to move into another province.
Yeah, I
Excellent.
think particularly because we're not attached to a provider or a service, we're attached to the individual. So we'll follow them through their health journey, wherever that may be.
That's fantastic. Great questions. All right. Does that close us off? I think so. All right. Well, thank you everyone for joining us today. At Serefin Health, we are committed to making care simpler, more connected, and more human for everyone we support. We look forward to continuing the conversation with you and getting the preview program to those who need it most. So again, please contact us to learn how you can participate. And I would like to mention that you will receive a copy of this presentation and this recording so you can hear all of those wonderful answers and share it with your colleagues. All right. Enjoy the rest of your afternoon, everyone. And again, thank you for joining.
Thank you.